the opportunity to testify today. My name is Dr. Jan Kaminsky. I'm an assistant professor of nursing, and I'm also the director of education for Rainbow Health Consulting. We work with healthcare professionals on issues that impact the LGBTQ community, and a major focus of our work, of course, would be the health and welfare of LGBTQ youth, including their interactions with public schools in the state of New Jersey. We welcome the focus on climate and culture at this committee meeting, and we'd like to further call the committee's attention to some of the challenges that are facing LGBTQ students in the public schools, some of which have been mentioned before. LGBTQ youth comprise over 100,000 students in the state of New Jersey by estimates from the CDC, which have given us some very new information that transgender students make up approximately 2% of high school students, and 8% of students identify as lesbian, gay, or bisexual. And of course, we have much higher numbers of students who are not sure of their identity, don't identify with one of those terms precisely, or who are not ready to disclose their identity. So those over 100,000 students in the state of New Jersey really deserve our time and attention. Research has shown that bullying of sexual minority youth can start as early as 5th grade. Of course, we have anecdotal evidence that says it starts much younger than that as well. We know that bullying, harassment, and intimidation set these vulnerable students up for a higher risk of substance abuse, mental health concerns, and self-harm, including suicide risk. This new large study that I mentioned that just came out looked at over 125,000 American students, and they reported that for transgender high school students, almost 35% had attempted suicide in the past 12 months. That number, it just has to break anyone's heart. LGBTQ students also expressed high rates of sexual risk-taking behavior, rape and other victimization, absenteeism from school to avoid threats of violence en route to and from school and during the school day itself, feelings of depression and hopelessness, and increased use of hard drugs. We are obviously gravely concerned for the health and well-being of these vulnerable New Jersey students who face real concerns throughout their school career, from speaking with a parent of a kindergartner, a transgender kindergartner who was repeatedly misgendered and called by the incorrect name, both in person and on the electronic data management system that the student school used, all the way through to lack of resources and support at all school levels. It's critical that all New Jersey school districts, of course, comply with the new legislation mandating education on LGBTQ history and culture. This will help ensure that students understand that all students, LGBTQ and non-LGBTQ, understand the complex background of history and contributions to the state, nation, and world. And based on the CDC findings that I mentioned, an important recommendation for decreasing these risk behaviors was access to culturally competent physical and mental health care in the school setting. From the faculty and staff perspective, Rainbow Health Consulting has observed a significant lack of consistent professional development for teachers, administrators, support staff, and school nurses around LGBTQ student issues in many school districts. And we believe that rigorous, professionally run, culturally competent training on these issues must be a statewide requirement for those who work with our youth in schools. And it must not fail to take into consideration the intersection of identities such as race, ethnicity, national origin, ability, religion, and other parts of the student's complex selves. This should include vocabulary and definitions, the importance of using a student's correct name and pronouns, again, both in person and also on paper and electronic student records, using LGBTQ inclusive language in classes, clubs, and in school nurses' offices, showing representation of LGBTQ history and stories around the school, the creation of supportive and inclusive district policies around such concerns as inclusive restrooms, locker rooms, athletic policies, and dress codes, including lessons that center the experiences of LGBTQ students or exemplars in curricula, the promotion of student clubs and activities formed around LGBTQ identities, and maintaining connections to outside resources to whom students and families can be referred, such as support groups, healthcare professionals, or social organizations. I have particular interest in health providers in schools, such as school nurses, health teachers, and physical education teachers who also plan content around health. That curriculum should be inclusive of LGBTQ themes around mental and physical health. Health classes should not be divided by sex, for example, but should teach all students about many types of different bodies and sexuality so that all students can be informed. Programs must be developed and utilized that help all students to understand sexual orientation and gender identity in an age-appropriate and accurate way. These programs should use examples of positive LGBTQ relationships and should include the need for safer sex practices, no matter the partner or identity. Additionally, these programs should actively work to dispel harmful stereotypes and myths around sexual orientation and gender identity. As I mentioned, in addition to providing further support for LGBTQ students, we need to provide non-LGBTQ students with resources to increase their knowledge and understanding of LGBTQ issues. Recent research found that even non-LGBTQ students benefit from having a Gay Straight Alliance or other such club in their school. They most certainly would also benefit from more inclusive health education and a more generally inclusive environment. We're confident that all districts within the state strive to provide support and resources to students to ensure a climate and culture of safety, health, and well-being, and we're ready to work with the committee in strengthening and enforcing the rights of LGBTQ students as they progress through our school districts. And I really thank you for the opportunity to speak before you today to talk about this most vulnerable group of New Jersey students. And I'd be happy to answer questions from the committee or submit further research on this topic. Thank you very much.
Thank you. And I think in light of the time constraints, if you have something, research findings, recommendations that you'd like to submit to the committee, we would be more than happy to take them.
Sure, I'd be more than happy to do that. Thank you.
Okay, thank you.